everyone, this is Melinda from the European Pain Federation, EFIC. I'm here today with Laura Mackey. Laura, would you please introduce yourself and tell us about your role in relation to EFIC?
Hi Melinda, thank you. Yes, my name is Laura Mackey. I'm a chartered physiotherapist from Dublin in Ireland. After I graduated from my physiotherapy degree, I undertook a PhD with Dr. Brona Fullen, who has recently taken up the position of president of EFIC. My PhD examined how varying levels of health literacy can impact on people with chronic pain. And I suppose I focused on three particular areas. The first area was how varying levels of health literacy can affect people's self-management skills. And we know that self-management is really important for patients to be able to, I suppose, actively engage with their management of pain. Second, I explored the awareness of health literacy amongst healthcare professionals. And then last, I explored how we could implement a health literacy sensitive intervention into existing pain programs, and I suppose explore the outcome of doing so. So I'm chairing the campaign. It's a multidisciplinary working group for the President's EFIC campaign on health literacy, and we've titled it Plain Talking. And the campaign's focus is to really increase awareness about the impact that lower levels of health literacy can have on health outcomes for people with pain and who experience pain.
Sounds very exciting. So what are the key issues and the key challenges of the health literacy campaign?
Well, we know based on research that there's a low awareness about health literacy and the impact that health literacy can have amongst healthcare professionals. And for those who are aware of health literacy, again, based on the research and based on my own research from my PhD, we know that they underestimate the levels of low health literacy in their patient population. There's a need to include health literacy knowledge or understanding of assessment approaches and also management strategies with a health literacy component or that recognises the role of health literacy. We need to start including those in our undergraduate and graduate programs. And as my research demonstrated that by implementing a health literacy sensitive program, it is achievable in existing pain management and treatments for people with persistent pain.
Excellent. So what does the working group want to achieve with the campaign?
Well, we're going to develop a campaign for healthcare professionals that will increase awareness about health literacy and the impact that varying levels of health literacy can have on people's ability to live with their pain. We want to provide a toolkit for healthcare professionals where written and verbal health literacy sensitive strategies can be embedded in existing pain services, and that has been very much informed by the evidence. And then perhaps most importantly, we want to ensure that all of the stakeholders that are involved in this process are involved in developing the toolkit and I suppose all of the other outputs of this campaign. And again, we want to start there with the people who experience pain themselves. We definitely want a patient or a public involvement in this whole process.
Wonderful. Well, thank you so much for telling us more about it, and we look forward to seeing more of the campaign. Thank you, Laura.
Thank you very much.